In China, we had a very good control. That's the policy of the government. So in dealing, I think in dealing with this kind of diseases, very infectious diseases, we have two policies. So perhaps strategy. One is suppression, and others mitigation. So in China, we choose suppression. So do our best as far as better. So trying to make this occurrence, the incidence, to the minimum, and then nobody can stop the spreading or stop the infection of this kind of disease. But we can try to do our best to inhibit the spreading. So that's what we are successful. So we try to knock down Wuhan. That's in the 23rd of January. So this is one way. Another way is trying to carry on the so-called interagency mechanism. That's the better understanding to myself is the so-called early protection. So wear mask and avoid going to the street and avoid the attendance of meetings, banquets, and parties, and so on. And that's one, early protection. And the second is early detection. And then if you found yourself had something wrong or something, you try to get to see the doctor as early as possible. Right. And the third is early diagnosis. Because in the Chinese government and the CDC, the right and the power of the making a diagnosis have been laid to the big hospitals. So you can go to any big hospital to get a check and make a diagnosis. And then, of course, the fourth is to the early isolation. So by this way, perhaps the core is distancing. Yeah. So just keep distancing, keep distance with others. So that's another way. By two of these ways, I think in China is quite successful in blocking the faster spreading of the diseases.